VASCU-GUARD vascular repair patch is derived from bovine pericardium and is used in peripheral vascular reconstruction, including the carotid, renal, iliac, femoral, profunda, and tibial vessels, and arteriovenous access revisions. VASCU-GUARD is packaged within a double pouch system. The contents of the unopened, undamaged outer pouch are sterile. Do not use VASCU-GUARD in patients with known sensitivity to bovine material. Open carton by tearing the seal tab and remove the outer pouch from the carton. Inspect the outer pouch. Do not use if the outer pouch is damaged or if the seals are not intact, as sterility may be compromised. Do not place the outer pouch in the sterile field, as the outside of the pouch is not sterile. Open the outer pouch and aseptically transfer the inner pouch into the sterile field. Rinse surgical gloves to remove glove powder prior to touching VASCU-GUARD. Inspect the inner pouch. Do not use if the inner pouch is damaged or if the seals are not intact. Open the inner pouch and examine VASCU-GUARD to ensure moisture of the patch has been maintained. Do not use if any folds, creases, or wrinkles are observed in VASCU-GUARD. Using aseptic technique and sterile atraumatic forceps, grasp the edge of the patch and remove the patch from the package. Immerse and agitate VASCU-GUARD for a minimum of 3 minutes in a sterile basin containing 500 milliliters of 0.9% sterile normal saline. At the surgeon's discretion, a room temperature pre-implant soak in solution may contain one of the following antibiotic treatments: ampicillin and gentamicin, bacitracin, cefazolin, cefotaxime, neomycin, or vancomycin. After 3 minutes, VASCU-GUARD is ready for implantation. Keep the patch immersed in sterile saline until ready to use. The patch must remain moist at all times. VASCU-GUARD may be tailored during surgery to meet the surgeon's needs. Visually examine both sides of the patch. If one side appears smoother, implant the smoother surface so that it faces the blood flow surface. VASCU-GUARD should be fixed in place according to standard surgical techniques. When implanting by suture, suture bites should be taken 2 to 3 millimeters from the edge of the patch. Discard any unused pieces of VASCU-GUARD in biohazardous waste. VASCU-GUARD must not be re-sterilized or reused.